The most popular month for babies being born might be giving away its title. Summertime births are not without the complications, and the number of deliveries in August might have something to say about that. Our Alex Osiris takes a look at the number of babies born across East Texas. It's new this morning.
Typically, the month more East Texans are born is slowly giving away that title, according to data from a few hospitals. One East Texas mom we found says delivering during the summertime still has its challenges.
The challenge we had was the heat. It was the heat, but we just stayed in and stayed cool.
One doctor explains the heat can also cause complications.
It's very easy to get dehydrated. Pregnancy's challenge is keeping adequately hydrated, because we know that when women get dehydrated, there's a much greater risk of preterm labor and preterm delivery.
Here's just some of the data we found at 4 leading East Texas hospitals. Comparing July and August and 2015 to this year, only Good Shepherd and Longview appear to have an increase between years. While August still looks like the most dominant of the late summer months for babies, Newman says a common misconception of babies born during the summer is that they get an increased amount of vitamin D.
In theory, sure. I think in practical terms, most people aren't taking their newborns outside in the summer and letting them bask in the sun.
He says even small children typically don't get a lot of vitamin D, as the amount of sunscreen usually comes as a trade-off to the intake.
It's fun. It's fun. They're all very active and they keep us busy, that's for sure. We do summer sports, and so our summertime goes by pretty fast.
Newman says there's often a clear baby boom year to year in cold weather spots, while warm weather usually stays relatively stable.
It is not uncommon in cold weather climates to see a bump in birth rate in the fall, just because it's 9 months-ish from the winter.
For Good Morning East Texas, I'm Alex Osiris.
Well, Dr. Newman says he's noticed a drop over the last couple of years in total births, which could be related to several factors.